The Indian capital, Delhi, routinely ranks as one of the world's most polluted cities. Its air quality alternates routinely between hazardous and unhealthy. Look at the weather app on your phone and you'll see what I mean. But it's especially bad in October and November each year. A seasonal mix of factors such as stubble burning by farmers, vehicular emissions and weather patterns literally cause people to choke.
Every winter, a dense smog descends on the Indian capital, making the lives of its some 20 million residents miserable. As in previous years, the toxic air poses a major health risk to the city's children. Ruchi Manjal is very concerned about her 3-year-old daughter, Anaika, who suffers from shortness of breath and a severe cough.
We take help of medicines at times. We have the visits to the doctors are very constant these days for children of this age group. So the situation is not at all good.
The family was even forced to buy air purifiers to help the air quality at home. The situation has also become critical in the capital's schools. After a week of no classes, this Delhi primary school is open today, despite the high level of pollution. But while classes have resumed, there is still a complete ban on outdoor activities.
How are you all?
Ridhima Karyal, a senior teacher, says that toxic smog in Delhi puts her students at grave risk. The majority of the children suffer from severe coughs and sometimes even faint. But the schools face a dilemma.
As a teacher, the biggest challenge is the students' health is very important, which we are trying to maintain. And second biggest thing is that we don't want the schools to be shut at this time again, because the 2 years pandemic has actually deteriorated the education quality of the school and the students as well.
According to the latest report from State of Global Air, more than 100,000 infants in India died within a month of birth due to air pollution. Another study has shown that 1 in every 3 children in Delhi has impaired lung function. This hospital in New Delhi is experiencing a surge of patients because of the city's toxic air. Pulmonologist Dr. Nikhil Modi has seen hundreds of patients, mostly children, suffering from respiratory problems. He says that situation is alarming and believes that Delhi's toxic air could trigger a serious health crisis.
Children is a very, very vulnerable group because they are young, their lungs are still in the development phase. So during the development, due to the exposure to so much of pollution, their lung before getting developed can get damaged, and that damage can be permanent.
Indian government is currently working on an ambitious clean air program. It aims to cut air pollution by 40% over the next 5 years. But that is a long wait for children like Anaika, who is already suffering from breathing problems.
Let's get more on this from Jyoti Pandya Lavakare. She's a journalist and author of Breathing Here is Injurious to Your Health, a book about air pollution in India. Ms. Lavakare, you have lived in Delhi for quite some time, which ranks as one of the world's most polluted cities. What is it like to spend a day in Delhi's polluted air?
It's awful. It's actually like smoking involuntarily. Your eyes sting, your throat just clasps and starts hurting. You get sore throats. You get sick really often. I get a dull pollution headache pretty much every time I step out. It's really bad. It's actually a human rights violation.
It's quite a thing to say, a human rights violation, but this happens particularly every winter in Delhi because it faces this thick blanket of smog that virtually shuts everything down. And it's caused by stubble burning on farms, vehicular emissions and construction dust. The question is, why does this keep happening every year and why is it not preventable?
It is preventable, actually, and the pandemic, the lockdown through the pandemic showed us how it is indeed reversible as well. When we saw clear blue skies, clean air in the winters of the COVID, the 2 years that we were locked in for COVID. But let me just quickly try and explain why this repeats itself every single winter. What happens is in North India, there is the Himalayan range, which sort of acts as a barrier to dissipate air pollution, especially the most harmful particles, the tiny microscopic PM 2.5 particles. What happens in the winter is when temperatures come down, there is something called inversion, where air pollution gets trapped closer to the ground. So we are seeing more dense micro particulate matter, which we then end up smoking, because I really can't call it breathing. Breathing is an involuntary activity, and when you're constantly smoking smoke and dust, then really it is a human rights pollution. Delhi turns, and most of North India, actually, I don't want to make this about Delhi, entire Indo-Gangetic plain starts smoking, and that's 510 million people who are pretty much in a gas chamber for most of the winter.
So the way you describe it, it sounds a lot like a climatic phenomenon. How do you prevent that?
So it's not just this is I only touched upon the geographic and meteorological reasons. What happens in the winter is when farmers start burning their crop stubble. That releases a lot of smoke, and the winds are turning around that time. So the smoke comes downwind all the way to all the dense urban centers. Also at that time, October and November, is when India sees its largest festival, the festival of Diwali, which is festival of lights, but seems to have become the festival of firecrackers. So you have like about 1 billion people bursting firecrackers, and even if everybody says, well, I'll just burst a few, you can imagine what sort of pollution there is in the air, not just microparticulate matter by now, because this has barium, nitrates, all sorts of chemicals. So now you're smoking chemicals in addition to the carbon particles that you're inhaling. And these lead to episodic highs, which actually hospital admissions in the winter have shown to have to rise sharply every single winter. And despite that, I don't think this is getting the kind of public attention or governmental attention that it needs.
You know, I did want to talk to you about the governmental attention, but just the way you describe it, it almost sounds like people themselves don't care enough to stop doing the things that they are doing that are contributing to this kind of pollution. Would you agree?
So I think there isn't as much awareness, and if I were to give an example, when COVID first started, not many people were aware of what this disease is and how it harms us and all of that. But the government was very good. It very quickly spread this information through phone calls. You couldn't make a phone call without getting the pre-recorded message on what COVID is and how it harms you and how to protect yourself. Nothing like this has happened for air pollution, which actually kills many more people. Air pollution is killing almost 2 million people every year in India, and that's many more than COVID does. And yet it isn't treated as a public health emergency, which it undoubtedly is. Air pollution actually is the most harmful. It causes more harm than disease and than war or any kind of even smoking. It's way up there as the most harmful public health emergency, and yet it is not given that attention by the government.
All right, so one is the awareness part of it. What about other solutions? You're also co-founder of an NGO, Care for Air. In your line of work, are you seeing enough solutions that people are working on?
Yes, there are people who are coming up with innovative solutions, but you really need, in a situation like this, you can't have a small number of people working in silos with innovative solutions. You really need the entire force of the government and the corporate sector. There is a lot of industrial pollution. There is a lot of vehicular pollution. We have crop stubble burning, which is completely avoidable and which contributes almost 44% of winter air pollution to the north parts of the country, and that is completely avoidable. You also have things like firecrackers, which in fact my group, the Supreme Court lawyer who's one of the co-founders of my group, petitioned to the Supreme Court and had banned from 2017, 18, 19. But despite that, of course, enforcement is not strong enough. So you have people, despite it being unlawful and illegal, to burst firecrackers, going ahead and doing that because they are not aware of how badly it's affecting them, their young ones, and their previous generation.
We'll leave it there for the time being, but thank you so much for joining us today. Jyoti Pandey Lavakare.